Hello, welcome to the COVID Ethics Update. I'm Ryan Pferdehirt, the Director of Membership and Ethics Education at the Center for Practical Bioethics. And today I'm going to be talking about the social contract and how it relates in a pandemic. In bioethics, we use the four principles. Those are autonomy, beneficence, non-maleficence, and justice. And we're really going to focus in on the principle of justice and how we serve our communities and serve each other with like resources for like people. One of the ways that we do this is through an idea called the social contract, most famously written about by Rousseau. And it answers the fundamental question of a democracy, which is, how can we all be free and live together? And the idea is that whenever we participate in a society, in a collective group, and we gather, certain limitations are put upon us in our behaviors for the benefit of the larger group. An example of this would be you have the freedom of speech, but you cannot say fire in a theater or shark at the ocean because of the harm that you'll be causing to others. While you still have that freedom to say whatever you want, because of the society, that freedom is tampered. And we, to some extent, agree to this whenever we agree to participate in a society. And the different level of society that we participate in creates more and more restrictions on our actions. If you wanted to live in a very rural, secluded area where nobody is around you for 50 miles, the actions that you can do become more expansive. You can live how you want to live, you can say what you want to say, but you don't receive the benefits that come with the society. If you want access to grocery stores, emergency services, and healthcare, then we have to put upon these restrictions on our behaviors so that we can benefit and live more harmoniously with each other. For the most part, this is done seamlessly. We understand the society, we understand these rules and these restrictions, and we agree to them, consciously or not, so that we can continue to participate in that society. If the restrictions get to a point where we don't want to participate, some people don't, some people will go to another society. And they are unique rules to the times and the society itself. And what we're seeing now with the COVID-19 outbreak and pandemics is additional qualifiers, additional restrictions being added to that social contract, and our continued participation is expected for the benefit of others. And this is very much a utilitarianistic perspective of we have to think about ourselves not as isolated individuals who have freedom, but more free agents within a larger system that you also have an obligation to each other. We have a right to our own freedom, but other people have a right to their freedom. And this is where we're trying to, in harmony, live together and promote the happiness of everyone. So what we're seeing now is expectations being put upon us that are outside of the norm, but understood that if these situations were to happen, these new qualifiers will be restricted. And people are understandably upset and frustrated by some of these, but we have to understand the intention of these actions, which is to function more properly as a society. So I think that our understanding of the social contract and understanding of our understood agreement within society is an important thing as we continue to deal with this pandemic. So I think the strong recommendation for everyone would be to continue to live in harmony, understand that these are expectations put upon us, but they are not forever expectations, and things will change. But the benefits that we receive from the society are, for the most part, outweighed the negative aspects of having the restrictions that are put upon us. So thank you for tuning in to the COVID Ethics Update from the Center for Practical Bioethics. Until next time, I'm Ryan Pferdehirt.